Hello, my name is Aaron McKnight. This video is for Nursing 360, Professional Communications in Nursing. This topic for my nursing paper is the nurse's role in addressing the opioid epidemic. First of all, I'd like to discuss opioids in general. Everybody knows that opioid is becoming a big crisis, but basically what is an opioid? Opioids are medications commonly used for the treatment of pain. Medications like morphine, fentanyl, tramadol, oxycodone, hydrocodone, and codeine are just a few of them. The problem is when these medications are taken for non-medical uses and when people misuse these medications, such as, taking somebody else's prescription, taking medications that aren't prescribed to you, and basically just the overall selling or the black market selling of other synthetic type of opioids, like fentanyl to be one, which is a big problem across the nation, which everybody's probably heard. According to the CDC, about 564,000 people have died from overdoses from opioids. The impact that opioids have on our society begins with destruction of families. If you have a family member who becomes addicted to the opioid, you could be looking at loss of revenue in the family. They may lose their job. They may have to go to treatment centers, which cost money. But the worst case, it could be death, which would really devastate a family. Another impact that it has on society, increased crime rates. Because once people are addicted to these drugs, they'll try to do anything they can to get them. They might lose their job. They still need money. So they may have to go steal or do other things in order to make money to be able to obtain these drugs that they desperately need. When it comes to families, they may lose a loved one to an overdose, but they may also have a loved one that ends up being hospitalized and disabled. That's a loss of income, which is very difficult to get through these days. Reason why I picked this topic, because in my opinion, as nurses, the biggest way we can address the opioid crisis is through education. Because the main role of a nurse is and always will be education. We educate patients, family members, no matter what kind of setting you work in. It's a daily basis. For example, if you work in pre-op, you're educating the patient prior to their procedure. Just like post-op patients. You're giving them education until they discharge. That's basically what we do. What we can do in this role is to start teaching our patients. The more knowledge people have, the more they won't be scared to address the situation. For instance, if we have a patient and you work in a hospital setting, and they've just had a surgery, and they're prescribed opioids, give an education on the proper way to take the opioids, education on pain levels. Maybe you don't need to take an opioid. Maybe there's an alternative. Then you can give them information on what to do with these opioids when you no longer need them, how to store them, how to keep them locked up, away from kids. Just simple things like that we do on a daily basis. Another thing we can do for opioid crisis, besides teaching prevention, which is the main deal and a big source of the whole crisis as a whole, is to teach what happens if a friend, a family member, or if you happen to witness in the community an overdose, signs and symptoms of it. How to be a good Samaritan, basically. How to call for help. And there's also, we can teach the use of how to use Narcan, which is a reversal agent for the opioids, which can help to reverse the overdose. Resources on how to obtain Narcan. Because Narcan is becoming a big thing these days, really popular. Law enforcement carries it. EMTs carry them. In a lot of cases, members of the communities are starting to carry it. especially live in a area of high risk with opioids, which most of the high risk areas happen to be rural areas. Which brings me to an intervention that I happened to find in my research, which I found very intriguing. Well, the best part was I'd already started this paper, and then the news came out that actually in the county that I live and work in, we're one of the first to have an opioid reversing Narcan vending machine that they placed. It's free of charge. I mean, people can go, they put in a number, they get a dose of Narcan. I think it's a maximum of 2 doses they can take. Well, the great thing about this is within 24 hours, the vending machine was emptied and they've already had to refill it. And it's in a high-risk area where there's a lot of opioid overdoses and a lot of cases of abuse, which I happen to see in the hospital that I work at. It seems like every year there's more and more people coming in with symptoms of opioid overuse and overdoses, which sometimes it can be debilitating. Worst cases, it can lead to death. But when you have Narcan available, people have, if they have the education, sometimes people won't even try to address using Narcan or carrying Narcan simply because they don't have knowledge of it. I mean, what does it do? And that's where we as nurses come in. We teach the family members, okay, not to be ashamed if they feel like they have a person in their family that is addicted to the to opioids. We give them resources. We teach them, okay, if you get Narcan, this is how you administer it. This is what's going to happen. And always seek help after you administer it. Because a lot of times, there's a big barrier to people wanting to help out each other when it comes to drug abuse. There's a stigma on people that are actually addictive. It's a disorder. Some people don't see it as a disorder. Some people just don't want to get involved. If there's other opioid users or abusers that happen to witness an overdose, they're less likely to even call emergency services for fear that they will be prosecuted for drug crimes. Which is why this vending machine is perfect. You don't have to give any identification. You have the Narcan on you. If something happens, you're able to actually administer it and save a life. And that's what it all comes down to. Saving lives will be a big part of slowing down the epidemic, as teaching can help prevent the epidemic. And that's basically what I base my paper on. Because as a nurse, we see every day how things can just go on and on out of hand. I mean, I've seen examples of people that may go into surgery, everyday people that you may know in your community. They may be prescribed like an opioid for pain. Maybe prescribe it for maybe a month. They get a dose. Well, they'll start taking this pain if they're not properly educated on other ways to take care of the pain. Like, you can take NSAIDs. That may help. I mean, there's yoga. If it's a musculoskeletal operation you had, maybe you need to see a therapist. There's even acupuncture in different situations. There's just so many different ways to try to relieve your pain. But if they're not given that education, then they start taking the pills. And it causes a little euphoric effect, which some people may get addicted to. So they begin to not just take the medicine to relieve the pain, they're taking the medicine because it feels good, which leads to addiction. Then that addiction leads them to go on to other things, other ways to feel that euphoric feeling, which brings into the whole substance abuse disorder, which is what greatly impacts this whole epidemic as a whole. So basically, in my opinion, education is the way to go. The more we educate people, the more knowledge they have, the more of a chance we have to slow down this epidemic or maybe even end it. And I thank you for your time.